Welcome to the Sky Therapeutics podcast. I'm your host, Tara Torres, a clinical nutritionist, researcher, educator, and consultant specializing in areas of weight loss, autoimmune disease, gastrointestinal disorders, metabolic syndrome, and other obesity-related conditions. I help clients improve their health through proper functional nutrition, professional-grade supplement protocols, exercise recommendations, education, and support using a personalized, evidence-based approach. At Sky Therapeutics, we offer functional nutrition solutions for chronic disease and help our clients develop sustainable lifestyle habits that will last a lifetime. As a friendly reminder, the information and opinions provided here today is to be taken as general information only, and you should always contact your personal physician or other qualified healthcare professional if you have any questions about your personal health and wellness. Hi, everyone. Welcome to this week's podcast where I have Stacy Cook joining me. Stacy is an occupational therapist with Mighty Oaks Therapy, and we recently connected over a mutual patient of ours, and I was just completely fascinated with what she does because not only does she do occupational therapy, but she also is certified in homeopathy, and she's going to talk to us a little bit about both today. So welcome, Stacy. Do you want to introduce yourself and tell us a little bit about you?
I do. Thank you for having me. I was glad when you suggested it. I don't know how to run a podcast myself, nor am I interested, but I'm okay to be on one. I'm Stacy Cook. I am 20 plus years. I've been an occupational therapist. So I started my career in Western medicine. I went to the University of Texas Medical Branch in Galveston. I knew when I was going through OT school, I wasn't sure which population I wanted to work in. So occupational therapists work in a variety of settings. They can work in an adult setting. They can work in geriatrics. They can work in acute rehab settings. They can work in a pediatric inpatient setting. They can work in a pediatric outpatient setting. Well, that's me. I'm an outpatient. I have a private clinic that I own myself. It's very small. It's just me there and another speech therapist. And what I do is outpatient OT services for kiddos with qualifying diagnoses. Yep.
And so occupational therapy is helping people through like daily day-to-day tasks that they need help with, right?
So what an OT does is look at your daily occupations, depending on your age in life. So, older adults are going to be doing different things than kiddos. So I happen to work in a pediatric setting. My first year as an OT, I was in adults in rehab and I liked it, but I had an opportunity to go into pediatrics and I was not convinced when I went to school that I wanted to work with kids. I was like, no way, they're germy, blah, blah, blah. No, I love it. It's the love of my life are my kiddos and their moms. I mean, I love connecting with my family. So yes, as an OT in a pediatric setting, I work on what a kiddo's daily occupation would be. So, there are OTs who work in like a work hardening setting where they're doing like functional capacity evaluations and they're helping people return to work. There are people who've had stroke and myocardial infarctions and they're working on rehabbing them back to full function. But in a pediatric setting, it's a little different. It depends on which diagnosis they come in with. So if someone comes in with if a parent brings a kiddo with Down syndrome in, we're going to be looking at first and foremost their low muscle tone and what is that impeding as far as daily function. Can they get up off the floor independently? Can they get onto playground equipment? Because a kiddo's one of their occupations is to play. That is one of their main occupations. So I'm going to look at different obstacles to function and assess what they need from me. But I work with a variety of diagnoses in my OT setting.
Okay, so let's talk about some of the other ones because that makes sense to me. Somebody who has a physical disability who needs help kind of navigating that. Now, before I ask you about other conditions, how is what you do different than, say, like a physical therapist who's maybe more exercising them and not daily function?
Yeah, even our billing codes are a little bit different. I'm typically billing a code for insurance purposes of therapeutic activities. So it's a little more encompassing and more activity-based. PTs are they can bill therapeutic activities too, but oftentimes they're billing for therapeutic exercises. So it's going to be really about range of motion. Yes, there's function too, but about strengthening, about activity tolerance, which is AKA some endurance for tasks. So they're going to be looking at also their lower body a little bit more than an OT is. I'm going to be looking at upper body we kind of just split the body into, and I'm going to look for fine motor deficits. I'm going to look for sensory deficits as well in the physical realm. And that's something an OT is going to be your person to go to in regard to like sensory deficits.
Okay, so that makes sense. So how do we apply that to kiddos who maybe don't have a physical disability, but maybe more of like a mental health disability?
Right. So, OT got its start way back in the day after a world war, and they were employed to help soldiers return back to functional occupation, whether they had a limb lost or just were recovering from injuries, rehabilitation, and their job was to get them back to function or doing occupations daily, so they had purpose and meaning. So, yeah, I mean, if a kiddo comes in and there's no physical limitation there, then what I'm going to look at is what the parent is telling me in regard to cognitive or even behavioral or sensory-based deficits. So if there's a cognitive impairment, there may be other practitioners that need to work on that case. If there are behavioral deficits, I'm going to look at, well, we're going to talk about that later, my homeopathic stint as well, but there may be gut microbiome stuff going on with that. Sometimes behavioral comes down to, can they sit still in a chair? Is the teacher giving the parent reports like, he knows when I say what is 14 plus 3, he knows the answer is 15, but he's running around the room and climbing up the cabinets while he tells me 15, right? So those are things I'm looking at. What is the underlying issue going on that he cannot sit still like his, I guess, typical peers and give that answer? Is there something internal going on? And so usually there's a sensory-based deficit going on with that I'll look at. And then behavioral, a lot of times there's sensory dysfunction or metabolic dysfunction or gut disruption that's going on that's feeding into behavioral issues. Yes, an OT is going to use external aids to help with behavior. So a lot of times, I look at a case and I may see, I know exactly this is probably a gut issue, but absolutely as an OT, I can look at visual aids because a lot of kids with sensory deficits, they use the sensory system that is working very well. And for many kids, it's their visual system. That has nothing to do with wearing glasses. It has to do with the sensation. Is the information coming in being interpreted well, sent to the brain well, and interpreted or modulated well in the brain? And visual system tends to be the one that's working best. So this is why we see kids like this all the time, right? Because their visual system is where they stay because it's the easiest to feed, it's the best one working, and their body's kind of going crazy. Parents will tell me all the time, he cannot sit still unless the graphics are in front of his face. I'm like, that's because he's using the one system that's working well. We need to work on the other systems. So you use an approach where you stay in the system that's working well while diving off into the systems that are not, and see what we can do to both rehabilitate or compensate for any deficits that have been identified.
Okay, so do you see a lot of these types of kids or adults with eating disorders or issues, swallowing maybe, or maybe they're having sensory issues, and how do you help them navigate that?
So a speech therapist often has certifications in swallowing deficits. But yes, there are kiddos who have sensory-based texture aversions or taste aversions or even temperature aversions going on. A lot of times this is metabolic in cause, right? So that's a whole different piece to that puzzle. But yes, many parents have come to me and said, hey, my kiddo is a picky eater, severely limited diet, will only eat these 5 foods. I mean, that's how you and I met because I was looking for someone who could really help from the functional nutrition part, because that's not my background. My background is therapy, Western medicine. I'm also a homeopath, so I use homeopathic remedies to help kiddos too. But there are definitely sensory deficits that are contributing to taste, temperature, and texture aversions that cause kids to severely limit what they'll eat. But another piece of it, and again, we can talk about it when we talk about homeopathy, is that, our gut microbiome dictates what we're to be fed. I mean, that is the truth of the matter. So if you have, an excess of candida in your gut, that is who is telling you, me as an adult, if I'm laying in bed at night, I'm like, I really want to eat a whole bag of Twizzlers. That's not me. Those are Candida telling me, go feed us, please. That's not Stacy. So recognizing that, and I think that's been a newer piece as part of the puzzle as an OT, teaching parents that this behavior right here, that's not your girl. That's not your boy. That is his or her gut talking and causing this. Let's get more to the crux of what's going on. And I've really been able to incorporate that, excuse me, since becoming a homeopath, to help educate parents on, I've met kiddos and I'm like, you haven't even met your kiddo yet. This is behavior from that gut. And we've been able to kind of structure things differently based on that information due to research and studies and training that I've done. But yes, that is definitely playing a role in behavior nowadays.
Yeah, and I think that's something that we have in common between homeopathy, occupational therapy, but also functional medicine is what my background is in nutrition is, but it's addressing the underlying root cause. And I think in order for us to give the most effective, customized, treatment plans to these people is to understand what exactly is causing it. And I think there's a big difference between a candida overgrowth that we can potentially control and eradicate, and then subsequently fix their cravings and all of that, versus something that's inherently like associated with autism. A lot of times we'll see cravings for carbohydrates in that way, right? And those are two very different things. We're treating those two very different ways, like you mentioned.
Yeah, that's right.
So how did you get into homeopathy? Were you just seeing all these people and just kind of trying to figure out ways to better support them?
Well, you say all these people know it started with one kiddo. So, I've been an OT for over 20 years. I love my kiddos, but my favorite part of my job is talking to moms. I mean, and dads too. I see dads all the time, but it's mostly mamas that I'm talking to. And, you know, that seed was planted in my heart long ago with talking to moms who really just wanted answers. What is going on with her? Why have things gone wrong with his development? What is the issue going on? And having those type of conversations is what brought me here today, because I saw just that yearn and that need in moms, and they were like, just I want more answers than what I've gotten. And it was a mom in the last 10 years of my career who set me off on this course to become a homeopath. So I remember having conversations with mom years ago, Stacy, I'm reading about heavy metals playing a role in my daughter's autism, and I used to work at this fish market and I ate a lot of fish in pregnancy. And could it be this? And having these non-therapy, nutritional or different type of conversations that really sparked it in me. But it was a more recent convo with a mom at my last job before I owned my own clinic, that she brought her kiddo in. I had been his OT since he was 2. He was now 4, and he had not spoken a word since I had met him. And he had been, had regressive autism where he was developing fine, and then overnight he wasn't, and had encephalopathy and had to be hospitalized. And, things were troublesome from there. And so the mom had started exploring alternatives for him. And the nanny had brought him in one day and she said, I have to show you something. And literally they were holding like something that was pretend microphone up to his mouth, and he was talking. And I was like, what? I mean, he was 4, and I was like, this kid has spoken no words, and it was like overnight, and it was a floodgate had been open. And so, as speech therapists, as PTs, as OTs, we're always looking like, what is the block? Why can't we get this kid to talk? What is there? And it was that day that it was like an epiphany for me. I'm like, this is metabolic. This is absolutely internal, that there are things that are simply blocking the brain from sending those signals to the mouth to be able to speak. Like, for me, that was the aha moment for me. And when I started, the nanny was like, you have to talk to mom about what she's doing. So I did. I had a great conversation with the mom. She's like, well, it's called homeopathy. That started me on because again, my whole career was based on having these conversations with moms who were desperate for new development, but also desperate for answers about what had gone wrong. So as an OT, I mean, I didn't grow up in like a crunchy household where we did like bees, honey, fresh out of the garden, blah, blah, blah. I didn't do any of that. I was like, where's the NyQuil? Where's the this, So this was all new for me. I've met homeopaths who've been doing this for a long time, but for me, I was like, no, I need to teach parents about this. So that's what started my path on my journey to become a homeopath. So I started telling my other moms who were interested, who were open to it, about what was going on with this kiddo. And I had a few that took me up on the offer, and I helped look for homeopaths that were available to do virtual appointments. One we found in California, one was here in Texas, and they started getting their kids' case taken. And I was like, when I started hearing the moms, giving me feedback, and I started doing my own research, I was like, that's it. This is the block that kids have needed to, the obstacle that kids have needed to traverse. And I want to be one of those people who can help remove these obstacles. So I put myself through homeopathic school, and 3 years later, I was a homeopath. So that's how I became a homeopath. And that is what I've incorporated into Mighty Oaks therapies. I am definitely still an OT, and I do OT sessions, every week. But I also take homeopathic cases, but not just pediatric cases. I take 0 to 100 cases.
Okay.
Yeah.
Okay. So, and homeopathy has been around for a long time. I was looking up, I mean, I think it started in like the 18th century by a German physician. So,
Yeah,
um,
Dr. Samuel Hahnemann. Yes, he's a German physician who was disenfranchised with bloodletting and leech pudding and blah, blah, blah. And he was like, there's got to be other things. He put forth a theory, tried to, or a hypothesis, tried to make it into a theory, and he was right. Does the energy of a plant, mineral, or animal substance, can it chase out the energy of a disease, basically? And
mhm.
he proved himself right with China officinalis. So, cinchona, Peruvian bark is, what he used as the first remedy. And it really basically eradicated malaria symptoms. So we do have in our planet still today a beautiful tree bark remedy that can help um, chase out, malaria symptoms if we ever have a malaria pandemic, right? But there are so many things that have been proven since then, material substances that have been turned into energetic substances that have been proven. Proving is where you have 20 to 40 healthy adults try out the remedy, and whatever symptoms they manifest, again, it's producing artificial disease because it's from nature, and whatever symptoms they manifest, it's recorded into a repertory, and those are the symptoms that it should chase out in the real disease. So when cinchona bark is taken and it produces all these malaria-like symptoms, and you give cinchona to a person with malaria, healing happens.
Okay. Because the basic principle is like cures like. And I
Yeah.
think the way I can relate to that is, and I see it in allergists and how they're treating allergies by exposing these patients to like low doses of the actual allergen. Is that the same?
Well, and the thing is though, and I don't know the ins and outs of allergists and what are in their formulas. I have not done that research, but my guess is that it's not homeopathically prepared. So a homeopathic remedy, or else it would be labeled as so. If it is, correct me. A homeopathic remedy, it has been potentized. So what a potentized substance is that it's been succussed and diluted. Succussion is basically where you shake up the energy of those atoms, those particles of the plant, mineral, or animal substance, right? Dilution is where you dilute the substance into having less atoms in the substance that you end up with. So let's say I took, let's do an animal remedy. How about sepia, which is the ink of a cuttlefish found in the ocean? It's an ocean remedy, right? So it takes on properties about that. It's an animal remedy. It has animal remedy properties, and it's got iodine associated with it. It's very good for hormonal stuff. So sepia, which is the ink of the cuttlefish. Let's say we took 1 drop of cuttlefish ink and put it in a vial. And then we took 99 drops of a pure water alcohol solution. A 1 in 100 drop would be a 1C. Okay. If you took it from an original tincture of ink, that substance. If I took 1 drop of that 1 in 100 dilution, it's already diluted 1 in 100, and put it in the next vial and added 99 more drops of water alcohol for purity purposes solution, then it would be, a 2C. So then each time you dilute, you're taking from the already diluted substance. And it's hard for people who, like me, when I was going to school, I was like, no, just no way, because I couldn't, I had my head in Western medicine. I was like, how can it be that you're going to take so much of that original ink from the cuttlefish and you're going to dilute it? But the thing is, it takes on a healing quality whenever you have less in that substance. So sometimes when I do in-person homeopathic trainings for my community, I do some free here locally, and I'm in Cypress, Texas. This is what I do. I'll bring a jar, like a little mason jar with one marble, and I bring a mason jar full of marbles. If I shake that jar full of marbles, this is just an example using kinetic energy, right? Because we're talking about an energetic substance. If I shake that jar full of marbles, you're going to hear them scratching and crunching, glass marbles up against each other. It's going to have energy in that bottle, and you're going to hear this low rumble in there. But if I shake the jar with one marble, the noise is ridiculous. It's going to be glass crashing against each other. It's going to make a lot more energy when there's less inside of that jar. So think about that in terms of dilution of homeopathic remedies. The less there is of the actual mother tincture or the original substance, the more potent it is. So a 1C is way less potent than 100C when you've diluted it 100 times. So yes, you're going to take a remedy that produces similar symptoms to someone who is sick, and you will have it diluted and succussed. Every time you dilute that potion, and you have to succuss it, shake up those atoms to activate it. And the more you potentize it, the more healing that that substance, the more healing properties that substance takes on.
Okay. So the greater the dilution, the higher the potency. And you're typically taking these in pellets, liquid drops, tablets. Like, how do you give this to people?
So my kiddos have a lot of oral aversion. So what I'll do is I even use tinctures or medicating potencies of them in a liquid alcohol form, or some kids can take pellets. They like to crunch the pellets. But yeah, they can be dropped on some people will say, oh, it's just sugar pellets. Okay, well, yes, there are sugar pellets involved, but the tincture, the liquid tincture of the actual substance is dripped onto the outside of that little sugar ball. And it just makes for easy administration. So a lot of homeopathic remedies come in easy to administer little vials where you just twist into the cap. That way you don't touch the actual sugar ball, because the tincture, again, is dripped on the outside. So when you twist it into the cap, you can just throw it into the mouth. So my kiddos who have, I have kiddos who will not even go for that, even if it's sweet tasting sugar, and there's no taste to the remedy. It just tastes like sugar in the ball. But I have kids who will not eat something like that. So what I'll do is I'll either use a medicating potency and dilute it in water, or I'll drop 3 sugar balls with tincture on the outside into a little dropper, 1 gram dropper. And then the parents can, squeeze off the lid and drop it into their mouth when they can catch them and get the remedy into their mouth. I've had moms dose when they're asleep, just drip it when their little mouth is there and drip it into you want the remedy to touch the mucosal membranes of the mouth, so that energy can be received by the body and interpret what it needs to do with it.
Okay. Yeah, that makes sense. So are there any safety concerns or side effects, risk factors, anything associated with this that we need to be aware of?
So if you take a remedy that is not well indicated for you, like people can access a small amount of remedies at their local health food store. I know Whole Foods was carrying for a while, Sprouts, even HEB. I live in Texas, so it's a big store here, but they have a little row of homeopathic remedies. You could go and see one that's for cough. And if you take that remedy, and let's say you have a headache after that remedy, all you need to know is that remedy is not indicated for you. You need to kind of go elsewhere because it's not a good indication. That doesn't mean you now have headaches forever. That doesn't mean you have a new symptom that you're stuck with. No, it's your body reacting to the remedy. Like, I don't need that. I need a different energetic signature of a different plant, mineral, animal. So if something like that happens, you simply stop the remedy, right? Sometimes when people have had responses to remedies, I call it a remedy response, that's not favorable, I have to listen to the case and say, but hold on a minute, is this just an aggravation? Are we going to work through this? Let's say I give a remedy that has caused the body to release some junk, right? Let's say I give a remedy, alumina, and the body has decided, oh, the energy of this alumina mineral remedy, that's a mineral, is greater than some of the aluminum deposits I have in my body. It may cause the body to release that. And if your body has a great GI tract, well, it might just poop it right out. If your body does not have a great GI tract, you might have some backup. So see how it's good that the body is responding to the mineral by releasing junk. But if you don't have a body or a terrain that can do the work, then you have to circle back and say, okay, how can we now support your body? Do you need some magnesium citrate that would help with peristalsis to get rid of junk, right? So we don't want this, staying in the body and being recycled, right? We want your body to eliminate it. That's the point. So that's what you could expect, like a remedy response. But again, sometimes you'll take a remedy and nothing I'm always more concerned if I give a remedy and they're like, nothing has changed. I'm like, got to go back to the drawing board, because I want a case moving forward. That's my goal, is to help people feel better, and to hear that nothing has changed. Oh, we need a new remedy. We need a different potency. We need to dose it differently. If someone, and sometimes responses to remedies that aren't favorable are easily fixed. If someone says, Stacy, you gave me, let's say sulfur remedy, that's another mineral, and now I'm having trouble falling asleep at night. And then we look at what we did. Oh, it's because I told you to take it at night. The fix is you're going to take it in the morning. So sometimes it's just a matter of tweaking. And this is why you would choose to work with a homeopath, for people who don't really know remedies. They don't know the materia medica, the set of properties that this substance has taken on to heal in the body. And if you don't know about potency and dosing, your homeopath would know. Yeah.
Okay. That's really interesting that you mentioned that, because I can correlate that to some of our gut protocols when we're trying to help somebody with, rebalancing their gut microbiome. Sometimes we can have what we call die-off symptoms. And so somebody who's maybe more constipated might become more constipated, or have the opposite effect and become looser, and vice versa. And we call those die-off symptoms. But like you said, there's workarounds to that. And a lot of times it's a good sign that we actually are shaking things up and that things are dying off. And like you said, we want those people going so that we can eradicate those and get them out of the body.
That's right. The goal is to shift the case forward, not to go backward. And there's another term in homeopathy I want to bring up. It's called return of old symptoms. So let's say I had a mom give a kiddo, I took the case and I say, Mom, this is our remedy. We're going to start here. And let's say that she says to me, you know what, Stacy, we've been a week on the remedy, and you know what, he's doing something he hasn't done in like 3 years. Like he's 8 now. He hasn't done this since he was 5. Oh my gosh, is this back? I am never, two things I'm never sad about. I'm never sad when a mom reports, or a dad, a return of old symptoms, because you can look this up in homeopathic materials and teaching resources. If there's a return of old symptoms, oftentimes this indicates we are moving in the right direction, because homeopathic prescribing and then subsequent healing occurs in an order. It occurs from the top down. In other words, I want to see that your depression is starting to be obliterated and removed before, let's say, your hip alignment comes into play, right? I want to see you moving from the top down. I want to see that and then from the center out, right? Your more vital organs to your distal, right? So I want to see that your heart palpitations have started, that they're obliterated or they're gone before your ganglion cyst in your wrist, right? So I'll know that I'm moving in the right direction. And the other thing, this is all according to Herring's law of cure, these 3 principles. The third one is in reverse order of occurrence. So if someone says to me, I had a car wreck 2 weeks ago, and tell me their symptoms from that, and then they say, and then 10 years ago, I don't know, I developed a chronic cough. Well, I'm going to be seeing probably the more recent injury starting to abate and be done before that chronic cough. That doesn't mean we won't get there, but see how it works in reverse order, your more recent symptoms as opposed to your more chronic and long-term. So it's the same thing. When a mom tells me, hey, we're back to where we were 5 years ago, I'm like, I'm not sad. I'm happy, because this and this and this is better. I'm not worried that that's returned, because it's like we peeled off a layer and we're at a new layer that includes what you were dealing with 5 years ago. And that was probably just suppressed and never really healed, right? So that's another thing I wanted to bring up. Return of old symptoms, I'm never sad about. And fevers. I love fevers.
Yeah, oftentimes that means like your body's doing what we want it to do. It's fighting off the infection or whatever, right?
That's right. And I always am prompting moms, Mom, whatever you're comfortable with. I have remedies that I can suggest to them if their fever gets over 102, blah, blah, blah. But if there's a mom that's like, yeah, I'll let the fever ride, it's not a problem. and whatever they're comfortable with in their family and whatever their doctor is comfortable with, then that fever's job is to burn off toxins, is to recalibrate the body. So I'm never sad when a kiddo spikes a fever after a remedy, because I know that we're moving in the right direction.
Yeah, yeah, same. I was looking up that law and remember seeing like mental and emotional symptoms being a part of that too. And I think I like that because I think that that's tied in with health and physical ailments so much. I don't
That's right.
think people realize how much those are tied together, your mental and emotional health with your physical ailments.
Right. I just took a case yesterday, and the mom has done a great job of just kind of, it was a behavior case. And, she's done a great job of thinking about these things. And she's like, I figured it out. This happens when such and such events occur every week or month or whatever. And it's completely psychosocial that triggers this behavior. And I'm like, very good research, mom, because that's going to help me in selecting the right remedy, because that's an important piece to our health, is the mental and emotional aspect too.
Right, right. A friend of mine was telling me she did treatment for eczema, and she said during the treatment, first her stomach got better. She started to notice like she had indigestion and bloating. But then she noticed other happy things. So not only did her gut health get better and then her eczema, but she had less joint pain and stuff. And I think people don't understand like the interconnectedness of all of these systems together.
Absolutely. And eczema is absolutely a gut microbiome issue.
Right.
Absolutely. Mhm.
Right. The digestive tract is tied to so many different things.
And if your digestive tract, your GI tract cannot eliminate, well, guess what your largest excretory organ is? It's your skin. So it's going to use the skin. So I'm always talking to my clients, if your skin is being utilized to excrete, it's because you have a liver that's overburdened, you have a GI tract that can eliminate. So we're always talking about these things for sure.
Yeah. So are there homeopathic
Homeopathic? Mhm.
treatments
Mhm.
for detoxification, and how do you support that?
It's so funny when people say homeopathy and then they have people saying homeopathic. It's like the syllable is different. Um, Actually, can you repeat your question? Are you saying
I guess I was
homeopathic
just
remedies for
curious.
GI tract stuff?
Yeah. So, I mean, you had my brain going. We were talking about the gut health and I'm like, okay, there's so much like die off and toxins. And then, anytime we're sick, we're trying to promote the detoxification of things. So what are you giving people, or what are like your best recommendations for people? Are there any tips and tricks and certain things they should look for if they're going to Sprouts to get some of these?
Well, yeah. So if you go to Sprouts, they have like a trifold, like a display rack with little chapstick tube sized homeopathic pellets. There's usually 80 pellets in a vial. I always tell my clients just to take one pellet at a time, because one pellet is the same as 5 pellets. I mean, if you took them an hour apart, that would be 2 doses. But taking 5 pellets at one time once versus taking one pellet at 8 o'clock and then one pellet at 10 o'clock, that's 2 doses. The amount of pellets doesn't matter. What matters is how often you dose it. And that's hard again for people who've been in Western medicine mindset to get across, but that's true because the amount of the substance is not as meaningful as how often you take it. But on the trifold layout there, the FDA requires that homeopathic medicines are represented to target a specific symptom. But that does not mean that that's the only symptom. So for example, Nux vomica would be there probably in a 200C and a 30C. Most remedies that you find are in a 30C. That's because that's what the older remedies were made, that up to that potency to start healing people. But you can get a 6C. Sometimes you can get a 30C there, a lot of 30Cs, but there are also higher potencies. So let's say you go to get Nux vomica. Nux vomica is the hangover remedy, we could call it, for acute care. Like if you drank too much the night before, that might be a remedy that really helps you the next day when you're dealing with the next day's symptoms. But Nux vomica is also very good for obstinate constipation, right? Nux vomica in a 200C is going to be very good for your emotional state when you're in your type A, I'm driven, I have to get everything done. There's so many qualities that a healing medicinal substance has taken on. It's not just good for the one thing that is listed there, but that is where I would suggest people start, because they've used a very prominent symptom to help guide people in selecting remedies. So if you do go and whatever, I don't even know what they've listed as the symptom for Nux vomica, and it matches your symptom, you can start right there. If it does list it as chronic or obstructive or congested constipation, you could start there. Another one for diarrhea might be sulfur, right? But if you don't respond to that remedy, it just means you need a different energetic substance. It's not the right match for your constitution. It doesn't mean that homeopathy doesn't work. So if you go and read that layout at your local health food store, that will help guide you. And sometimes they have a little book there that you can take with you. And so you can read up on what might be good. Here lately, I've had a lot of people who are looking for lung and throat and cough issues going on. And so I'll say, go to Sprouts and see which one, matches, your symptom the best. For people who are not my clients, for people who are my clients, I will do something more specific. But that's a good place to start, is looking at those that describe your symptom well. Like spongia might be a really dry cough and it's a barking sound. Versus like a wet cough, which might be Antimonium tartaricum. You could find that or a remedy there too. So, yeah.
What about for allergies? Would you recommend? Because right now it's crazy allergy season. I feel like everybody's complaining about it, and I'm dishing out vitamin C and quercetin left and right. But
Yeah.
top favorites you could mention for people?
Yeah, I'll mention two. So if you have a clear nasal discharge, right? It's not yellow, it's not green, so there's not some other element going on. It's just a mucosal membrane response to some allergy in the air, and it's just clear liquid coming out. That's your mucosal membrane, right? Inflamed and filling up with the liquid to stop those receptors, right, from taking in that allergen or that pollen or whatever. If you have a big nasal discharge and you have a watery eye, just a classic allergy response, a great remedy is called Allium cepa, spelled Allium and then CEPA. It's made from a red onion. And so think about when you cut a red onion, right? What happens to your face? Your eyes may start watering and itching. Your nose may be itchy and run clear, not with yellow or green. So that remedy has been found to really help in hay fever and allergy issues when there's a lot of pollen going on. If it doesn't help you, that just means that's not the one for you. You may need another one. But another good remedy is called Histominum hydrochloricum. That's a sarcode. A sarcode is a remedy made from healthy tissue, right? Your body releases histamine in response to, allergens, right? Or actually in response to inflammation, when it needs to create inflammation in the body to ward off an issue. And that remedy has been made from the energy of histamine. So Histominum hydrochloricum is a remedy that is really helpful in inflammatory states. So I would say out of those two, that one has been especially helpful. And I know on that trifold display that Histominum is in both a 6C and a 30C potency. So if someone just has a little bit of an issue going on, they might do fine with a 6C, a lower potency. But if it's a little more pervasive and severe, like I have friends in Austin who are going, or who maybe they're coming out of it now, but they were going through cedar fever. I mean, your whole face just swells up. I would say, yeah, get a little higher potency, the 30C. In fact, I just did tell my friend to get it, and she was like, oh, night and day. So that's a good remedy to help, because that's a more of an isopathic as opposed to homeopathic, right? You use cinchona bark as a homeopathic, which is like cures like, to help with malaria symptoms, right? But this is using actual histominum in a remedy in potency form to clear out histamine from your body, to get your body to calm the inflammation down, right? And so it's here's saying we would call that an isopathic remedy, but it's still prepared homeopathically. So those are two good remedies to consider for hay fever and allergies.
Awesome. That's fascinating. I'm definitely going to be stopping by and checking out the little brochure and looking into it more for sure.
That's right.
Okay, so you and I recently discussed putting on a talk soon, and this is going to be for our behavioral disorders, adults and children, but I think it's more geared towards our kids. I have had an influx of children with behavioral disorders. And so I wanted to mention that at the end of this recording, just to kind of give everybody a heads up that it's going to be coming hopefully in April, but you and I are going to gather at a local cafe. There's going to be some amazing food, and we're going to put on a little presentation discussing how you and I collaborate and help these kids and grownups with behavioral disorders. Because there's a lot, I think you have a lot of golden nuggets when it comes to occupational therapy and homeopathic remedies, but I also have some nutrition interventions. You had mentioned one of those remedies as being really helpful. I feel the same way about fish oil and like the impact on cognitive function. So I definitely want to highlight those and allow people to ask questions when we do meet. So it's going to be no charge on our behalf. There might be some charge for food for those of you coming, but we definitely want to encourage anybody in the local Northwest Houston area to come. And we're going to open the floor to dialogue about this, ask questions, and we're just here to support everybody and bring some different tools to the table besides, conventional medicine options.
That's right. I mean, parents are very much looking for answers nowadays, and I mean, I just find in my practice, everybody is sick. I mean, or has some ailment, some way going on. And a lot of it has to do with gut health. So that will be the bulk of what I talk about, is how I use remedies to target that. But I'm excited to do that. I think we're going to shoot for an evening time because I've presented there before. It'll be your first time. But I usually present in the morning, but I think in the evening it'll be so helpful because then people, won't be worried about work and there won't be that scheduling conflict. So we'll still work on the time and the date, but if people want to come, great, because I want to answer questions because again, people are not feeling well and they're looking for what is going on, that root cause, like you caused it. So I'm excited about it.
Me too. I'm so excited. And I appreciate you coming and joining me today and sharing your information. I feel like there's so many more things that we could talk about for a couple hours here, but I appreciate it. And if anybody has any questions, feel free to reach out. I'll bring Stacy back if there's anything specific, but otherwise stay tuned. We'll be sure to let you guys know about this upcoming talk.
Goodbye, everyone.
Thanks. Thank you for listening to the Sky Therapeutics podcast with your host, that's me, Tara Torres. If you enjoyed today's podcast, be sure to check out any bonus info and links in the show notes. You can visit us at www.skytherapeutic.com or find us on social media because we love connecting with our audience. Until next time, be well.